Okay, good Wednesday morning, everyone. I think we've got everyone from executive team here. So we'll go ahead and get started right on the dot at 9:30. It's a wonderful morning. We've got coffee brewing in the break room, so everybody is definitely happy about that. And we do have several questions that were pre-submitted. One thing that we are going to do also is if I'm sure many of you were on it, but probably not everyone. We did do a presentation for stakeholders on our 1915C waiver changes on Monday afternoon. We were unable to get to all of the questions there. So what we did, as promised, is grab a bunch of the questions from the chat box so that we could answer them today. So we're going to start on those once we kind of get things going, and then we'll go into some of the pre-submitted questions that were also provided to us specifically for this office hours. But we're going to start the way we always do and turn it over to Commissioner Turner to welcome us today. Good morning, Commissioner.
Good morning, Karen. Thank you, everyone, again for joining us today. I will be very brief. As Kara said, we've got a lot of good questions that came in. Hope you guys are all having a good week. And if you have not had a chance to look at it, I hope that you find some time to look at our budget presentation that we did for the House this week. Had a really good, responsive, and very receptive committee to our budget, recognizing the importance that you provide as providers and also our DSPs. That was quite the focus of the conversation. So I hope your DSPs are able to see that and understand that there are folks on the Hill that recognize and appreciate what they're doing. So as we start working to continue to move that process forward, we obviously want to continue to hear from you about impacts and things that are happening in your world that we can share and that we can work on together to make sure that we create a better working environment for you guys and continue to develop a strong partnership. So with that being said, I'll pivot back to Kara and we'll start answering questions. Thanks, Kara.
Thanks so much, Commissioner. Okay, we're going to start with those 1915C leftover questions, and I think I've got them all, and I think I'm starting at the point where we left off. Is there a way that ET supports can help with visits? For example, regional RD services, support coordinators, case managers, seeing that a lot of us cannot physically see our person supported due to the pandemic, it would be nice for ET supports to help with this. I'm going to turn this over to Jordan to start us off.
Thanks, Sarah. Good morning, everybody. So it's a good question, and I appreciate the opportunity to provide a little bit of clarification around this. So certainly the availability of remote visits, as they're indicated in the approved Appendix K document, will remain in place. I think we talked a little bit last week about the extension of the approved Appendix K amendment. That will be, although we don't physically have the signed extension in hand now, we do have indication from CMS that we should await approval, and approval will date to the expiration of the current Appendix K amendment. So point being, we're going to have approval to extend the same virtual latitudes that we have provided throughout the pandemic. Now, how that interacts specifically with enabling technology is a little bit of a different story. Certainly, there would be no expectation that people supported would be purchasing through the allowance in the Appendix K, and as you've seen in the 1915C proposed amendment, availability of enabling technology as a covered benefit going forward, there would be no expectation that a person would purchase a device that was capable of allowing virtual visits, specifically for the purpose of allowing therapists or agencies or support coordinators to be able to interact with them virtually. Enabling technology packages, while those devices can be used for that, and if someone owns one, and if the device in effect is facilitating implementation of enabling technology in a person-centered way as directed, described, and desired by that person, then certainly they could use an iPad or a phone for any other alternative means. But as the primary catalyst for approval, just being able to facilitate virtual visits will not qualify under either the service development or approval process for enabling technology.
Awesome. Thank you very much, Jordan, and stay there. Next question is for clarity, the individual served in 1915C will now be assigned to an MCO. The assignment of the MCO will be based on that individual's current primary or secondary insurance carrier, not based on some type of COS meeting or meeting with the person. Jordan, you want to explain?
Sure, Kara. So everybody right now currently in HCBS programming has an assigned MCO. And so as we move to alignment on 7/1, that MCO will remain the same. So everybody has a current MCO provider, and they will be those that are moving into the managed care environment on 7/1. Obviously, will be added to the caseloads of the applicable managed care organization.
Thanks a lot. And then final question, well, there was one that was also a part of the chat, but also a submitted question for today, so we'll get to that in just a second. Will the increase of $1 per hour for self-direction of healthcare tasks only be applicable to people who are choosing consumer direction?
Yep, good question. So anybody who's receiving services post 7/1 anticipating approval of the amendment will have the opportunity to self-direct their healthcare tasks. And certainly, again, this applies to those non-skilled nursing tasks. The skilled nursing tasks that have traditionally been observed as such have been defined and will continue to only be available for skilled nursing application, but anybody will have the opportunity to decide to self-direct healthcare tasks come 7/1 forward. And then in the instance that they make that decision, that additional $1 per hour will be paid to the direct support staff persons who are performing those tasks.
Okay, and now this question was part of the chat box, but also submitted today, so I'll get to this. Will there be an opportunity for new waiver recipients to select independent support coordination agencies for the coordination of their services, and how will that occur? Jordan.
Yep, another good question. So as we move into an aligned environment, certainly we're having discussions, as we've talked about in each office hours for a couple of different months, discussions about what case management, what aligned case management will look like, whether or not ISCs or contracted independent support coordination agencies will in fact be managing care for new members coming into the ECF program is an evolving discussion that we're having right now with TennCare and with the MCOs. So I can't give a definitive answer on that at this point, but it certainly makes sense that if what we're trying to do is create a single and aligned system of case management, that the responsibility of managing care across the different platforms until we can achieve a single system approach makes sense for continuity purposes, for training purposes, to assure that all care managers, be it MCOs or ISCs or our own state case managers, are managing care respective to behavioral health, medical health, and then waiver services in one. So certainly that's a conversation that we're pushing, and as soon as we have a definitive response on that, I'd be happy to provide it to the ISC work group and here in office hours.
Thanks, and I'm going to give you a break now, Jordan. Next question is, since contracts will now be held with MCOs, will each ISC agency still need to have a physical location in each grand region they serve? I'm going to turn this one over to our Director of Licensure and Risk Management, Dave Harrell. Dave, can you provide some insight?
Yes, thank you, Kara. This is something that we have been working on for several weeks now. And like Jordan says, if we're going to be moving toward an aligned system, then we want to make our requirements as closely aligned to the MCOs where appropriate as we can. And so to answer the question, for ISCs and every provider who operates in more than one region, you will no longer be required after July 1 to maintain an office in each region, assuming you have electronic documentation. So if you are maintaining paper files in those offices, then you will still need to maintain an office. And any offices that are open, for instance, if you have an office where people come and get supplies or get their checks or things like that, then those will still be subject to licensure surveys on an annual basis. But the requirement for an office in each region will go away as of July 1.
Thanks a lot, Dave. Okay, turning it over to our questions about the pandemic and vaccination. So now we'll start with Dr. Davis. first question is if ISCs get vaccinated, can they resume home visits? Dr. Davis, would you like to answer this one?
Yeah, so just to put a little background to this, the CDC has stated that people who are fully vaccinated, so when all parties are fully vaccinated, there is the ability to have interactions, visits with people face-to-face without masks. And so this is a new change. However, that does not necessarily mean that we have changed the Appendix K guidance, which is basically at this point that those visits by ISCs are still prohibited. We are evaluating this situation, and as things change, which we expect that they will in the near future, I think there will be new guidance that's coming out. So at this point, though, I am wanting to say we need to stick with the guidance that we've been given, which is that in Appendix K and through the other point that I want to make about this is that congregate care facilities have a different guidance that they need to operate under, and I think that many of our agencies out there probably want to consider looking at the CMS guidance as it relates to this to develop their policy or continue to revise their policy as it relates to visitation and other matters. So, Kara, we're still within the throes of this. Maybe we're in the last throes. I hope we are, but we've probably got a little bit longer that we've got to stick with things. And then, hopefully before too long, we're going to be able to get things opened right back up and be back to normal. So that's where we are right now. Kara?
Okay, thank you very much, but stay. The CDC is now saying that people without vaccinations can spend time in single households without masks. How does this work for the residential homes? Now, you kind of touched on a little of that, but kind of if you want to expand any more for this specific question.
Yeah, and so we've left all the way along. We've left it up to agencies to develop their own policies regarding visitation. I think that needs to continue at this point. Again, I referred folks to the CMS guidance, and actually we can post that at some point after I get through answering this question. But that's really what you need to attend to. I do think we're at a point we need to be evaluating our visitation guidance, and we encourage every agency to be doing that at this point. Kara?
Excellent. Okay, next question. If a vaccinated person is exposed to the virus, what steps do they have to take? Dr. Davis.
Yeah, so here's another little instance where the CDC guidance in comparison to what we're doing within congregate care facilities or facilities serving people in a congregate fashion are different. And of course, our waiver settings are a little bit different from a congregate setting. So there are lots of moving parts with all of this. But the CDC has stated that people who have been exposed no longer have to quarantine for the period required for quarantine after an exposure. So that is a change. That is general population guidance, though, not necessarily guidance that should apply to healthcare facilities where we're still very concerned about the spread of the coronavirus. So agencies, again, are developing their own policies with respect to this, but this is, the type of guidance, I think, the type of information that you want to use in fashioning your policy. Kara?
Thanks a lot, Dr. Davis. And one more question. If a vaccinated person later turns up positive with COVID, what steps do they have to take?
Yeah, here's one area where nothing has changed, and so you continue to have to quarantine yourself when you have COVID-19. You have to quarantine yourself for that 10 days, the last 24 of which have to be symptom-free. And unfortunately, we have found that a number of people who have been vaccinated are testing positive, and so unfortunately, also they have to continue following those same rules for quarantine during that period. Kara?
Okay, and those are all of our questions that were submitted. I'm looking in the chat box, and I am not seeing any questions there. I will mention to everyone, and you'll see that we did have a presentation on Monday about the 1915C waiver changes for stakeholders. And we also have scheduled a family-focused presentation for families about the 1915C waiver changes for tomorrow, Thursday. And I think that presentation is from noon to 1, and I hope I'm Central, and I think I'm saying that right. But Carly will go ahead and put that information in the chat box. We did get a new question. When will the new REM training for administrators be available, and how do you get it? I am going to turn that question over to Teresa Sloan, our Assistant Commissioner for General Counsel. Teresa.
Thank you, Kara. We anticipate that training will be ready by April 15th. We're trying to maybe hit April 1st, but definitely April 15th. And that training will be accessed through the web. So we will put it on the REM page, like we've been placing most material or all materials to try to make it a little bit easier. And we will let everybody know via a blast, as Kara calls it. I'm not really sure what it is, but we'll let everybody know when it's up so y'all can start taking it. Thanks, Kara.
Usually I mean listserv blast when I'm talking about blast, but we will absolutely let everyone know when that is up. Can the link to the REM page be shared? We'll make sure that Carly gets that in the chat box. Just as a reminder, and Teresa, you might want to, that REM page, if you have questions about REM, that is our landing point. We update it almost every other day, and we will continue to do everything we can to do what we can to provide those that information to you as timely as we can. Will the Family Focused webinar be recorded? The Coalition's Disability Day on the Hill event is scheduled at the same time. Well, that's unfortunate, but yes, it will be recorded. So, so if it's just me and Jordan and Patty talking with no one, we'll understand why, but we'll have that available for everyone to review at some point. The REM webpage is up in the chat box, and I do not see any other questions. Oh, nope, I spoke too soon. When will we receive confirmation of registration for the REM training? I registered myself and another employee in February, but there was nothing sent after the forms were uploaded to the DIDD cloud. Teresa, do you have any insight in that?
I do, thank you. The training that we ask people to register for is a provider investigator training. That's a training that the folks will have to do who are going to conduct the investigations at the agency. We are still collecting all those names. I think that everyone had till March 15th to provide them, and so that we could get through them. Communication will be going out shortly, and we will let everybody know when that training will begin. Thanks, Kara.
Okay, and with that, I see no further questions. So we are going to go ahead and close out this week's edition of Office Hours, and we will do what we always do, and I'll turn it over to Commissioner Turner to see us on out. Commissioner.
Yeah, thanks, Karen. Again, thank you for your questions and your submissions today. We certainly want to make sure that we provide you some answers to those questions when you submit them, and I appreciate all of those that were able to contribute today. Again, continue to send us questions, comments that you've got. Keep us informed about some of the challenges that you're seeing. We have a lot of legislators that reach out to us just asking questions and wanting to make sure that DIDD is available to talk to them about what's going on and us be able to share our success stories. And that's what we've been doing a lot this week is telling them what's working and how providers have been working hard to manage the pandemic and person support and things like that. So again, thank you for those questions today. Look forward to doing it again next week. And we're getting back out on the road. I think some of you have seen that. We've been traveling, and we're slowly going to keep doing that. So, you know, we're working on getting some visits set up and making sure that we hit all of the 3 grand regions and seeing folks that are doing good work. So thanks again for your questions and comments, and I'll pivot back to Kara.
Okay, thank you guys so much for joining us this week. We'll be here same time, same place next week, and look forward to taking your questions and having a chat with you then. Have a great Wednesday and have a great rest of the week. Goodbye.